The case history. Introduction. A case history can be considered to be a planned professional conversation that enables the patient to communicate his symptoms, feelings, and fears to the clinician so that the nature of the patient's real and suspected illness and mental attitudes may be determined. Objectives: arrive at a tentative diagnosis for patient's history, determine any specific factor that might affect formulation of a diagnosis, determine any systemic condition that require special precaution prior to or during dental procedures to protect the life and health of a patient. Specific differences between child and adult patient. Child is a distinct human entity and should never be considered as just a miniature adult. They have excessive movement, short attention span, variable communication, physiological changes due to anxiety and fear reflects what he or she has been told about dentistry. Variant anatomy. Parents' attitude must be assessed. There any unpleasant experience may be transmitted to the patient. First dental visit projects influence on child's future behavior towards dentistry. Vital statistics. It includes date, OPD number, name, age and sex, ethnic group, school and class, address, contact number, parents' occupation, pediatrician or family physician's name and contact number. Date records the time the patient reported and can be referred back during the follow-up visits. Case number. It is useful for the purpose of maintaining a record, billing the individual, and for legal considerations. Name. A patient usually likes to be called by name. This will help to elicit the history properly. In case of pediatric patients, addressing the patient by his or her name or pet name will encourage him or her to talk freely. Advantage of knowing the patient name are identification to maintain record, communication, and psychological benefit. Age. Knowing the patient's age is beneficial to the clinician in many ways. Chronological age compared with dental and skeletal age can be useful in determining growth and development of a patient. Diagnosis. Certain diseases are more common at certain ages. Sex. Some diseases show sex predilection. Anorexia is more common in female while hemophilia may be found exclusively in males. Girls mature faster than boys, thus their treatment may be required earlier. Aesthetics and emotion is more of a concern in female patients. Male patients are more prone to trauma during playing. Child abuse or sexual abuse or exploitation is more common in case of females. Address and contact number. It is necessary for future correspondence and scheduling follow-up appointments. Full postal address of the patient should be taken for future communication. A few diseases have got geographical distribution. Dental caries and molted enamel are dependent on fluoride content of the domestic water. Dental carie is more common in modern industrialized areas, while periodontal diseases are more common in rural areas. Parents' education and occupation. It is helpful in knowing the attitude and approach of parent towards a child's oral and general health. Expensive treatments cannot be given to patients with low socio-economic status. Pediatrician or family physician. It may be required in case of emergencies or when an advice is needed regarding any medical condition of the patient. Chief complaint. Definition. It is a patient's response to the dentist's question. Chief complaint is the reason for which the patient has come to doctor or the reason for seeking the treatment. The chief complaint should be recorded in the patient's own words or as described by the parent and first attention should be given to it. Chronological recording. Each of the complaints should be recorded in chronological order. If few complaints start simultaneously, record them in the order of severity. Do not interrupt the patient if possible. Significance. Chief complaint aids in diagnosis and treatment planning. Most common chief complaints are pain, loose tooth, delayed eruption, caries, swelling, halitosis, bleeding gums, and malaligned teeth.
History of presenting illness. Elaboration or detailed description of the chief complaint. Elaboration may be in terms of duration, mode of onset, severity, nature, aggravating and relieving factors, etc. Gives an insight towards the possible cause and nature of disease. History of pain, which includes origin and mode of onset, intensity of pain, progression of pain, nature of pain, duration of pain, radiation or referred pain, type of pain, time of occurrence, precipitating and relieving factors, anatomical location. History of swelling includes duration, mode of onset, progression, impairment of function, symptoms, and recurrence. Past medical history. This should include operations, hospitalizations, infectious diseases, immunization, allergies, accidents, blood transfusions, etc. Past dental history includes past dental care and child's reaction towards it, any previous unpleasant experience, oral hygiene habits, fluoride therapy, etc. Prenatal and postnatal history. Prenatal history includes history of the mother during her pregnancy period, nutritional disorders, drugs like teratogens, tetracycline, viral infections, accidents or trauma, abnormal fetal position. Natal history, history of child at the time of birth. Injury to TMJ during forceps delivery can affect growth of the condyle. Cyanosis at birth may indicate congenital cardiac defect. RH incompatibility may lead to erythroblastosis fetalis. Postnatal includes history of the early infant period, feeding habits, nutritional disturbances, trauma, childhood disease, developmental milestones, as well as history of immunization. Family history includes it provides the details of size of the family, socio-economic status, order of birth, number of siblings, and details of any familial conditions or traits that exist. Drug history includes the details of the drugs being used for systemic ailments, any non-drug allergy, any drugs already used for the condition. Personal history includes details about brushing habits to know the awareness about oral hygiene, any deleterious oral habits, type, duration, frequency, etc. Details of activities at home, in the school to rule out conditions like learning disorders, autism, etc. Behavioral history includes receptive or intimidating. Any clues of negative or unpleasant behavior during the previous dental visit may call upon the need for behavior management or shaping. Diet history includes vegetative or mixed, any snacking between meals, number of sugar exposures per day.
Examination. Most important findings that lead to diagnostic headway are often detected on routine examination. The dental examination not only includes intra and extraoral examination but also comprises of complete general examination. General examination. Height and weight both have direct relation with developmental and nutritional status. Gait, look for any abnormality in gait. Example, waddling gait, limping gait. Posture, look for any abnormality. Vital signs include pulse, heart rate, and respiratory rate. Different child at different ages till this reach the adult value. Hence, clinician should have a thorough knowledge of these physiological variations. Any other data like illness, malaise. Extraoral examination, shape of head. Dolichocephalic is long and narrow head and narrow dental arches. Mesocephalic, average shape of head and arch. Brachycephalic, broad and short head. Facial form. Mesoprospic, average facial form. Uroprospic, broad and short facial form. Leptoprospic, long and narrow facial forms. Facial profile: straight, convex, concave. Examination of nose: profile, shape, and contour may identify both breathers. Examination of chin prominence, mentalis activity can indicate habits and malocclusion. Examination of lips: competent lips are in contact when musculature is relaxed. Incompetent lips seal is not formed in normal circumstances. Only hyperactivity of oral musculature can help in forming closure. Examination of TMJ: functional examination should include palpation and auscultation of TMJ and associated musculature. The function of TMJ is examined by palpating the head of mandibular condyle and observing the patient with mouth closed, open, and during random movements. The patient should be examined for any clicking sound, crepitus, pain, hyper or hypomobility of jaws. Mouth opening is also related to TMJ function and should be also examined. Normal mouth opening is 40 to 45 mm. Lymph node examination: a complete examination of neck region, including the lymph nodes, is mandatory. Ask the patient to bend his neck in forward and downward position to palpate the lymph nodes on the side and to bend it forward to palpate the submandibular area. Intraoral examination: this includes the examination of hard as well as soft tissues. Soft tissue: complete inspection and palpation of all soft tissue oral structure is needed. Look for any variation of any abnormality in the following areas by evaluating the color, consistency, contour, texture, and size. In case of lips, the palate or pharyngeal tongue, floor of the mouth, buccal mucosa, gingiva, and periodontium, as well as tonsil, is evaluated. Hard tissue: following things have to be noted in examination of teeth: teeth present, decayed teeth, mobility, occlusal review, canine relationship, incisal relationship, midline, fluorosis, developmental anomaly. Provisional diagnosis: this is achieved on the basis of all the above parameters and includes a plethora of options which have to be evaluated. Investigations: these include all necessary investigation that can be required to reach a final diagnosis like radiographs, blood examination, advanced diagnosis. Final diagnosis: this is a final conclusive answer that has been reached upon by applying investigative reports to our differential diagnosis options. Treatment plan: this includes the following phases of treatment. Emergency: the first and foremost objective of the dentist to relieve the patient of his acute pain, any other acute symptoms. For example, if a patient has reported with acute swelling and pain, the first task is to provide him relief by performing emergency access opening. Medical: this include prescribing of antibiotics, analgesics, and stabilizing any other medical condition that may affect the dental prognosis. Preventive: the phase includes risk assessment by caries, diagnosis, dye charts, and other preventive protocols like pit and fissure sealant, fluoride application, ART, etc. Preparatory: this includes behavior management and consultations with various other departments for interdisciplinary approach. Treatment plan includes restorative, endodontic, surgical, orthodontic, periodontic, or prosthodontic treatment that are carried out as an active phase. Maintenance: its variation depends on the patient's disease status and begins from 1 week up to 6 months or even 1 year. Conclusion: to summarize, a clinician can be successful in rendering a comprehensive treatment by means of updating his knowledge timely, Nevertheless, the role of examination, diagnosis, and treatment planning still play the pivotal role in rendering the same, even with the constant development of the science and technology. All the latest techniques do not yield the desired results if these three fundamentals are ignored.